Tell us about yourself.
I'm a compassionate and reliable individual with a strong passion for helping others. I have completed my PSW training and have experience in providing care to individuals with various needs, including elderly care and support for those with disabilities. I'm a great communicator, enjoy working in a team, and am always eager to learn more about how I can improve the quality of care I provide.
Why did you choose to become a personal support worker?
I have always been drawn to helping others, and I find it rewarding to make a difference in someone's life. Working as a PSW gives me the opportunity to provide physical, emotional, and social support to those in need, particularly the elderly or those facing health challenges. It's a field that aligns with my values and allows me to give back to the community in a meaningful way.
What do you think are the most important qualities of a PSW?
Some of the most important qualities of a PSW include empathy, patience, good communication skills, and being detail-oriented. It's crucial to understand and respect the dignity of clients while providing care, and to communicate clearly with them and other healthcare team members. Being reliable and having strong problem-solving abilities also help in delivering high-quality care.
How would you handle a difficult or challenging patient?
With difficult patients, I first focus on being patient and listening to their concerns. I would try to understand their perspective, acknowledge their emotions, and provide comfort. Sometimes, a gentle approach and reassurance can go a long way in easing anxiety or frustration. I also remain professional and follow the care plan, while ensuring their safety and dignity are always maintained.
How do you prioritize tasks when providing care?
I always begin by assessing the immediate needs of the client and addressing any urgent health or safety concerns first. After that, I follow the care plan to ensure all tasks are completed on time. I also regularly communicate with other members of the healthcare team to ensure that I'm not missing anything important and to update them on the client's condition.
Can you describe a situation where you had to work as part of a team?
In my previous role, I worked alongside nurses, family members, and other PSWs to provide comprehensive care for a client who had multiple health issues. We communicated regularly about the client's needs, and I made sure to keep track of all the tasks I was responsible for. By collaborating with the team, we were able to provide the best care possible, and the client's condition improved significantly.
How would you deal with a situation where you have to handle personal care tasks for a client who is uncomfortable with it?
I would approach the situation with respect and sensitivity. I would explain what I need to do, ensure the client understands, and make sure they feel comfortable. I would try to make the experience as dignified as possible by maintaining their privacy and showing empathy. If the client is still uncomfortable, I would discuss alternative solutions or consult with other team members to find the best approach.
What experience do you have with medication administration?
I have experience with assisting patients in taking their prescribed medications by reminding them or helping them take them at the correct times. I'm trained in understanding the importance of medication schedules and reporting any missed or refused medications to the healthcare team. I always ensure that medications are given as prescribed and document accordingly.
How do you handle stressful situations, especially in the context of caregiving?
Working in a caregiving role can be stressful, especially when faced with emergencies or complicated situations. I manage stress by staying calm, prioritizing tasks, and breaking down the situation into manageable steps. I also take deep breaths to stay focused and reach out for support if needed. It's important to stay professional and ensure that the client's needs are met, even in challenging circumstances.
How do you ensure the safety and comfort of your patients?
I ensure safety by following proper protocols, such as using mobility aids correctly and making sure the environment is free of hazards. I'm always alert to any changes in the patient's condition, and I report any concerns immediately. For comfort, I maintain a caring and respectful approach, providing the patient with emotional support and making sure they feel heard and valued.
Why do you want to work for this organization?
I admire your organization's commitment to providing high-quality care and fostering a supportive environment for both clients and staff. I feel that my skills and values align with the mission of your organization, and I'm excited about the opportunity to contribute to the positive impact you make in the community.
How do you deal with clients who may be confused or have memory issues?
I approach clients with memory issues with extra patience and understanding. I would speak slowly and clearly, using simple language to help them understand. I would also give them extra time to process information and try to avoid rushing them. I make sure they feel safe and heard, and I rely on visual cues or reminders to help them stay on track.
What would you do if you noticed a fellow caregiver was not following proper procedures?
If I observed a fellow caregiver not following procedures, I would address it professionally and respectfully. I might first approach the individual in private to discuss the issue and offer support if necessary. If the behavior continues or is more serious, I would escalate the issue to the supervisor or manager to ensure that care standards are maintained.
What is your experience with using assistive devices?
I have experience using a variety of assistive devices such as walkers, wheelchairs, and lifts. I'm trained to use these devices properly to ensure the safety and comfort of the client. I also make sure that the client is properly positioned and that the device is adjusted to suit their needs. I always make sure the equipment is in good working order before use.
What are your strengths and weaknesses as a PSW?
My strength lies in my ability to remain calm under pressure. Whether it's dealing with a sudden change in a patient's condition or managing multiple tasks, I stay focused and prioritize what needs to be done. I'm also very empathetic, which helps me build strong, trusting relationships with clients.
Can you describe a time when you had to deal with a medical emergency?
Yes, there was an instance when I was caring for a client who suddenly began having difficulty breathing. I immediately checked their airway and called for medical assistance. While waiting for the ambulance, I stayed calm, reassured the client, and followed the emergency procedures I had been trained on. Fortunately, the client recovered quickly with the help of emergency services.
How do you handle working with clients who have special dietary needs?
I always take care to ensure that clients' dietary needs are respected. I follow the instructions provided by healthcare professionals, such as ensuring they avoid certain allergens or have specific food types. If I notice any challenges with their eating habits or dietary requirements, I report these to the appropriate team members for further evaluation.
How would you respond if a client became upset or agitated?
If a client becomes upset, I would first try to understand the cause of their agitation. I would approach them calmly and with empathy, offering reassurance and a listening ear. Sometimes, a simple conversation can diffuse the situation. I would also assess whether there is a physical cause for their distress, like pain or discomfort, and address that if necessary. Ensuring their safety and emotional well-being would be my priority.
How do you ensure confidentiality when working with clients?
I take confidentiality very seriously and always ensure that personal and medical information is kept private. I would never discuss a client's details with anyone not involved in their care, and I make sure to store any documentation or information in secure places. If I am in a public area or discussing a case, I always ensure that privacy is maintained.
How would you handle a situation where a family member of the client disagrees with your care approach?
In such situations, I would first listen to the family member's concerns and acknowledge their perspective. I would then explain the care plan and the reasons behind certain actions in a clear, respectful manner. If the issue persists, I would escalate it to a supervisor to ensure that everyone is on the same page and the client's needs are met appropriately.